50-year-old man with cough, wheeze, flushing, and diarrhea. Chest X-ray showing a triangular retrocardiac opacity obscuring the left paraspinal line as well as the medial aspect of the left hemidiaphragm. CT scan confirming the left lower lobe collapse. This is the left lower lobe collapse. Along with the left lower lobe collapse, there is a centrally located or left hilar mass of mixed attenuation, but mainly of soft tissue attenuation with a calcified component. This mass is most likely obstructing the left lower lobe bronchus with secondary or with resultant left lower lobe collapse. This is associated with, can you see this lesion? Associated with right hilar lymph node, right hilar prominent lymph node. And also associated with, can you see this? Multiple simple hepatic cyst. This is one cyst and this one and this one. Okay, and if you go down, there are multiple simple hepatic cysts. Okay, sorry. Yes, there's another one here. Another cystic lesion is seen here. Okay, so the interpretation here, this patient has a centrally located obstructing lung tumor with secondary left lower lobe collapse. The diagnosis, the most likely diagnosis is carcinoid tumor. Why? Why this lesion is most likely to be carcinoid tumor and not hamartoma? As you know, carcinoid tumor and hamartoma, both of these lesions can be calcified. Hamartoma also show popcorn calcification. So both of these lesions can show calcification. However, carcinoid tumor is more likely to be centrally located and more likely to be of soft tissue attenuation and more likely to be symptomatic with wheeze. This is very important. This symptom is very important as the wheeze is most likely to be due to bronchial obstruction. So this lesion is most likely to be symptomatic. Okay, so when the patient is symptomatic with wheeze, think of carcinoid tumor more than hamartoma. Okay, however, hamartoma is more likely to be peripherally located and not of soft tissue attenuation. It's more likely to be of fat attenuation. So fat attenuation is a landmark for hamartoma more than the calcification. Calcification can be seen with carcinoid tumor as well as hamartoma. However, the fat attenuation is more with hamartoma. Okay. Also, hamartoma is more likely to be asymptomatic. Okay, discovered incidentally. okay, more likely to be asymptomatic. However, if the patient is symptomatic with wheeze, flushing, and diarrhea, this is more likely to be carcinoid tumor, okay? The other differential diagnosis is bronchial carcinoma, okay? As this is a hilar mass or central located mass, so it could be bronchial carcinoid or bronchial carcinoma. So the diagnosis here is bronchial carcinoid with left lower lobe collapse. What about the hepatic lesions? The hepatic lesions could be simple hepatic cysts. However, hepatic metastasis from carcinoid tumor with cystic degeneration should be also considered. So, how to exclude hepatic metastasis with cystic degeneration? This part of the management can help in excluding any mets in the body from the carcinoid tumor, which is PET CT scan, octreotide PET CT scan, okay, can show any metastasis in the body from carcinoid tumor. So the management here, this patient needs more histological or more pathological investigations. This patient needs bronchoscopic, okay, bronchoscopic biopsy from this mass, okay. This patient also needs more radiological investigations to look for any mets in the body by octreotide PET CT scan. I will show you the octreotide PET CT scan. This is the octreotide PET CT scan for carcinoid tumor. This isotope scan can show any metastasis from the bronchial carcinoid. This patient also needs urgent referral to the chest clinic to guide the management or to guide the treatment, which may include bronchoscopic removal of the bronchial carcinoma. That's all. Thank you.